Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well. And I want to give you a little bit of a update in the practice, kind of what's been happening lately in the last probably couple months. A lot of challenges the last couple months. I'm sure as you know out there, but I want to talk about some things that have been commonly asked, kind of new trends and things that we're tending to see in the practice. Because of what's happening in the world, especially in the Midwest here and in Michigan and the cold, winter weather and that, and just cover some things to think about with COVID, but also post-COVID, in cases that are maybe milder or mild to moderate, and whether, and actually this is any kind of respiratory viral condition that's shoulders up. Meaning sinus and all that. So I just want to review some things, that trends and stuff that we've seen, and then something that are some big mistakes that I'm also seeing, and I want to be clear on that, and you should share this with others, because this is a big thing. So we all know, or I shouldn't say this, we all know, but most people that follow a channel like mine or listen or share these videos and that, some basics. I'm not going to repeat a bunch of basics for the last, year and a half, 2 years about, your C, your zinc, your D, your quercetin. You can watch other videos on this. There's a million videos out there about this, and I can give you details about each one of those things. But I want to talk about if you're doing too much and what to look for, okay, and also some unique things that we're seeing post-COVID or during COVID, and some things to look at. But also, maybe not what to do, but what not to do, okay? Or what, when COVID's over, when you've had this mild to moderate case, what to do to get back to normal, okay? And I think that that's really important, because a lot of us, of course, fend this, fight it, defend it, and get through it, the majority of us, right? Of course. But it can be, again, mild to moderate, and what do you do to get back on your A game, okay? Even myself, I had it about 5-6 weeks ago, and I did grow a third horn, but, joke, but, it wasn't fun, but you get through it. But I think what's most really difficult, and I've seen this a few times here, and I actually had 2 people today tell me about their spouses. Kind of unique that 2 different women came in today and told me about their spouses, about the psychological and issues that are kind of going on post-COVID. Now, post-COVID, you're kind of talking about, unless you just recently had some of this new Omicron or whatever variant, viruses mutate all the time. So whatever variant it is now, it seems to be milder. So we're talking about, when you're talking about post-COVID right now, probably talking about most people that were hit a little bit harder a month or 2 ago, or 3, 4, 5 weeks ago, roughly, and definitely more significant. And what the side effects, what are the aftermath, how do you rebuild that, okay? So a couple things really simple I just want to cover, though, is this. How do you keep your viral load low, whether it's mild or moderate? You keep your viral load low, and this is any virus. This is absolutely any virus, okay? And you've heard me talk about this before, but using some silver, a colloidal or hydrosol silver that is, I like usually 15 or 20 parts per million or higher is better, but silver is an excellent product. I'll tell you here at the end where you can get some of this stuff. Also, you can dilute iodine, do it appropriately. There's a lot of recommendations out there. You do absorb iodine though, and it does affect tissue, including thyroid tissue, if you do too much. But doing that nasally 3-4 times a day, okay, especially if you're in acute illness, keeps your viral load down. The whole goal here is to have a good immune system and to keep your viral load down, okay? And this is why we see people with the virus actually, if there are 3 or 4 in the house, sometimes the 3rd or the 4th person to get it actually have the bigger viral load and the harder hit, okay, with the virus and symptom, because the viral load is built up. So how do you keep that low? Iodine nasal washes, silver hydrosol. In fact, here's another company I use, this Physicians Total Health, this nano silver. I believe this one is even like 25 or 50 parts per million, but good stuff. I could tell you where to get it. I'll tell you at the end of the video here. But anyway, that's great stuff. That small of parts per million, you are not going to trap it in your body, okay? But again, Things not to do is don't overdo the nasal spray or nasal irrigation iodine either, because yes, it will kill virus in the upper respiratory system, the nasal system, but you're also actually potentially affecting, in a month or 2 or 3 out, your thyroid if you're overdoing it, okay? And we do see here, and I'm a big proponent of testing iodine and replacing iodine for breast health, thyroid health, and all that, but you do have to watch, okay, and very carefully, you do have to watch when some people take too much iodine. I've seen it a few times where you get these side effects with thyroid. You get thyroid toxicosis, your thyroid can go crazy, you can burn out your thyroid. Now later on you have to take medication, so be very, very conscious of that. What else should we do? And it's, again, simple. When you have, actually had a couple cases of this in the last month, but I call it silent pneumonia. Basically is this: you develop an infection in your lung during COVID or post-COVID, and again, you're not gonna see this a lot maybe in the last week or two because we've seen a downtick. We treat probably about 20, 30 people a day here of our patients with COVID-19, and most of them are pretty mild to moderate. But if it gets into the respiratory system and into the lung, obviously you can get silent pneumonia. And silent pneumonia, I call it that because basically you may not have a big cough. You may have actually, of course, fatigue and a little bit of shortness of breath. I think we all get that a little bit when we have any virus. You're just a little bit fatigued, but you're not coughing a lot. You may not even have a fever, okay? But after about 7 to 10 days, you start to develop actually some changes in your lung. Can even be microcirculatory changes, microclotting in that, and you can develop a viral sequela of bilateral, they call it COVID pneumonia. How are you gonna know if you have that, okay? You can't rely on if you're coughing. You could potentially rely on if you're having significant shortness of breath or chest pain, okay? And obviously you should go seek medical help ASAP. But if you have a pulse ox, which you can get these for 20 bucks on Amazon, is a pulse ox will give you a good indication if there's changes in your lung. And I will 100% tell you this. In the last year or so, we've saved lives with you telling patients to get pulse oxes and use pulse oxes. And yes, 99% of these patients that use a pulse ox, a week or 2 later, they're better. It's just a metric that you can have to be able to use at home with an infection, any type of, by the way, a respiratory potential infection. But anyway, you put the pulse ox on and you want your oxygen to be at least 95, 96% or above. And it doesn't get much different, it's not too much risky unless you go below 92 or 93%. It's usually telling me, that's starting to tell me something's going on in your lung, and you should call your doctor, call your provider, and at least get a chest x-ray or seek some help. Now, of course, what not to do. You can't rely on a pulse ox if you have nail polish on. If you're a female and you wear nail polish, your oxygen is going to look lower, okay? Occasionally, if you're working around that, you can turn your pulse ox to the side so it picks up your capillary and your blood flow here on the side, and that will help. But the whole point is the change in your pulse ox. So meaning if your pulse ox is consistently 95, it's consistently 95. That might be you, it's fine. You can see your doctor, not in an urgency manner. But if it's 97 or 98 and a week later now it's down to 93 or 94 and you still feel good, that's why we call it silent. So don't just sit at home. These are people that go on to more moderate cases and more severe and have more hard time recovering, okay? So make sure that you have around somewhere in your household or with people some ability to check your oxygen, and it's really the chains of oxygen. So watch that, okay? And you might simply need to go to an urgent care, or if you're one of our patients, we'll order a chest x-ray or something like that on you. But the point is that is a way to know if you're developing a secondary condition, okay, in your lung. And again, that's going to hit you when it hits you, and some people get acclimated to their oxygen being lower, so a week or 2 later, actually their oxygen can be down in the low 90% or even 80%, upper 80%, and they'll think that they just are tired and their virus is still fighting them. Usually if this happens, it's going to happen around day 7 to 10 or later. So 7, 8, 9, 10 is where you if it's going to really happen, you're likely going to see it. What else to look for? And this is a big one, something I see in the practice here all the time. So listen, okay? You should not exercise and go back to exercise and training if you have anything significant, okay? Until your fever, aches, energy is at least 90% back. And definitely with a fever or coughing or symptomology for at least a week or two after the infection. The reason your body is recovering, you've just used a lot of adrenal function. You've taxed your adrenals. There's studies on this. People's cortisol get wiped out. Okay, so do not push yourself. Now, I'm telling you this, and I'm saying exercise every day. I'm addicted to exercise, whether it's spinning or weightlifting or playing hockey or what have you. I'm very active. So it becomes a real mental game. In fact, even for me, probably I think harder part with COVID was actually dealing with the kind of fatigue and just not getting back to the robust, energetic, normal self, quickly. But the point being here is this. Now, again, if you have a sniffle, a runny nose, you're a little bit, sinusy, no big deal. But if you're really fatigued, if you're had a fever, if you have body aches, if you have shortness of breath, if you've had anything, what we talked about the pulse ox, you want to wait at least a couple weeks before you start significantly moving your body, whether it's, now again, should you walk around the house? Should you get fresh air? Should you move your body? Absolutely. Okay, you need to transfer oxygen and get your blood moving. But the point is you don't want to stress your body until you're significantly recover, about 90% recovery, okay? And then it should just be about 30-40% of your normal exercise. And if that feels good, within a few days, you can uptick it, okay? I have patients coming in that are going to the gym within a week or two, going kind of back to their normal self or their normal routine, and they're a little bit tired and all that, and they're hitting it hard with either HIIT training or heavy lifting and all that, and they go backwards. They get a kind of a few steps back. And what does that do? Well, you're taxing your adrenals that are already taxed. We've had multiple people, including a couple of my employees, that actually have had COVID within 1 month of each other, twice, okay? And sometimes it's because of the stress and what's going on. Sometimes it's because of re-exposure and all that. But if you have a weakened immunity and your adrenals are one of your strongest defense mechanisms, okay? It's by the way, I want to say this because you don't hear much about this in defending COVID-19 and fighting the infection, but is your adrenal hormone DHEA is very pivotal. There's studies on immunity, fighting infections, cancer, cardiovascular disease, but it's part of your immune system. It's a big part of the reason why younger people don't get hit as hard with infections in general, but including COVID, okay? So the point being is DHEA, an adrenal hormone, you need to be, robust and strong and, have a more optimal level in the upper quartile. And when people actually have, adrenal fatigue, if you will, or they're 40, 50, 60 years old and they're not replacing DHEA, which you want to replace a quality DHEA. I always prefer to take 7-keto DHEA, get a lot more benefits and immune effects and cleaner and doesn't metabolize into other hormones. But a key thing too with DHEA is it helps dihydrotestosterone, part of a byproduct of testosterone, to get into cells and muscle tissue to actually create energy and glycogen, and it fuels the cells, fuels the tissue, fuels the muscle for recovery and muscle growth and all that. So point being is DHEA, an adrenal hormone, really helps your immune system, and this is very key in the defense of any infection. But I want to, again, state that. How can you tell besides just that 90%? I'm 90% better, okay? By the way, get air, go on a walk. If you're recovered, stretch, do some, simple yoga, meditate. The key is recovery till you feel, pretty much 90 to 100%. But how do you know? How would you know if your body physiologically isn't recovered? Elevated heart rate. Now, if you're one of our patients here in a functional medicine practice, we're always talking about blood pressure and heart rate variability and potentially your pulse oxygen and, insulin and sugars and A1Cs and all these metrics and simple things that we track. But, so point being is your resting heart rate is a very good indication of your fitness, your health, your immunity, and your recovery, okay? And it's been studied and it's well documented already, and I can tell you clinically, we have multiple people coming in that are just simply asking, like, yeah, man, since I had COVID 2 weeks ago and I'm fine, it wasn't that bad, but my heart rate is literally 10, 15 beats higher than it was my typical resting heart rate. What we're seeing is most of this recovers pretty quickly within another week or two, but it is a sign that your body is still in that adrenal adapting recovery. And so you really want to be careful, okay, with stressing your body with exercise if your resting heart rate, okay, is elevated. I mean, a few points, no big deal, but if it's 10 points up or 15 points up or 8 points up from your normal baseline, you want to be careful with that. So be careful with exercise and listen to your body, okay? You're gonna make a lot more gains and a lot more improvement and get a lot more benefits, sometimes going a little bit slower till you know that you're 100%. The other thing about a few things not to do and at least watch out for. I'm a big proponent of vitamin D. You can watch videos on this from me. You guys know this. It's well known about COVID-19 and the benefits. And yes, there's a lot of immune benefits, but you can become vitamin D toxic. Now, a lot of vitamin D toxicity comes from hypercalcemia, high calcium. It draws it into the blood. And the problem is that you're not going to feel it till it's too late. So in what number is that? Well, it really depends. It's very rare. It's extremely rare. But I have seen, because of people are taking large amounts of vitamin D, and maybe they don't stop, or they're just, taking this high volume, maybe 10, 20, 30, 40,000 IUs even a day, not just for the week they're sick, but for weeks and weeks or months. And I've seen cases where we can't even test how high it is. They have high calcium. That is dangerous to the heart, to arrhythmias, to calcifying also arteries. So you don't want calcium being laid down anywhere in your body, okay? And so I want to make sure that either you're getting vitamin D tested, but your goal for vitamin D is between 60 and 80, kind of right around now, this time of year. I like to keep mine at 80, a little bit closer to 100, okay, in the upper quartile, but safe. What does that mean? Well, you got to test, even if it's just every 4 months or 6 months. But I want to make sure our people that are replacing and supplementing vitamin D, that they are, and usually you do need a pretty high dose, being fat soluble to build up in you. But once you've been on 10,000, 20,000 IUs for a while, you should not continue that kind of dose at that high without testing to know where you're at, so you don't get these side effects. I've actually had people have even bone pain, kind of nausea, electrolyte issues. You can get into cardiac issues and muscle issues. And so you should be careful. Now, is this rare? It is extremely rare, okay? But you do want to avoid that. So other than that, those are the main things that are big that you want to watch out for. Sleep is very key for recovery, okay, in your immune system. And also good hydration is very key, but listen to your body. So hopefully that's helpful. I was talking about a few of the supplements, and you can get other supplements on our website. And those supplements are, in our COVID-19 protocol that is very commonly used, and we dispense with our patients out there. And I'm sure I've heard they've been shared all around, and exactly what our approach is. Early treatment is key. Thank goodness the new variant is very mild, and so that is wonderful. But in the big picture is that hey, build your immune system, take the right supplements, early treatment, use a functional medical practice physician, providers. This way you do well. To get any of our supplements or any of the things I talked about in this video, you can go to our website, go to the supplement shop. And the password for supplements is health. We're here always accepting new patients, me and my practitioners, and always bringing you the best in health and wellness and functional medicine. This is Dr. Lewerenz. Be well.